Hereditary hemorrhagic telangiectasia, HHT, or Osler Weber Rendu syndrome, is a rare genetic disorder characterized by abnormal blood vessel formation in the body. This video will cover various aspects of HHT, discussing its genetic mutations, molecular basis, clinical manifestations, and management strategies. Hereditary hemorrhagic telangiectasia, HHT, is caused by mutations in genes like ENG, ARL1, and SMAD4 that regulate blood vessel formation. Severity and complications of HHT can vary depending on specific gene mutations. Accurate diagnosis and personalized management require understanding the genetic basis of HHT. Abnormal blood vessel formation in HHT, called angiogenesis, results in fragile vessels prone to bleeding. Dysregulation of the TGF-beta signaling pathway, often due to genetic mutations, contributes to HHT. Understanding these mechanisms can lead to potential therapies. Endoglin is a key protein that regulates blood vessel biology. In hereditary hemorrhagic telangiectasia, HHT, mutations in the ENG gene disrupt endoglin function, causing abnormal blood vessel formation. Understanding these molecular mechanisms is crucial for developing targeted therapies. Pulmonary arteriovenous malformations, AVMs, are abnormal connections between arteries and veins in the lungs. These AVMs are a hallmark of HHT and can have significant clinical implications. Angiographic imaging techniques, such as computed tomography, CT, angiography and pulmonary angiography, are employed to classify these AVMs based on their anatomy and hemodynamic characteristics. The classification system allows for a standardized approach to diagnosis and aids in determining the need for intervention. By familiarizing ourselves with the angiographic classification of pulmonary AVMs, we can better understand their clinical significance and guide appropriate management strategies. In patients with hereditary hemorrhagic telangiectasia, hepatic arteriovenous malformations, AVMs, can lead to high-output cardiac failure. Managing this condition involves a multidisciplinary approach, including embolization of the AVMs and heart failure management. Different strategies will be discussed. Cerebral arteriovenous malformations, AVMs, are abnormal connections between arteries and veins in the brain. In individuals with HHT, these AVMs can have devastating neurological consequences. Patients may experience symptoms such as headaches, seizures, and neurological deficits. The management of cerebral AVMs in HHT requires careful consideration of individual patient factors, lesion anatomy, and associated complications. We will explore the neurological manifestations of cerebral AVMs in HHT and discuss the optimal strategies for diagnosis, monitoring, and treatment. Epistaxis, or nosebleeds, is one of the most common and debilitating symptoms of HHT. The severity and frequency of nosebleeds can vary significantly among patients, resulting in a wide range of impacts on their quality of life. Severely affected individuals may experience social isolation, anxiety, and decreased productivity due to the chronic bleeding episodes. Understanding the impact of epistaxis severity on quality of life is crucial for implementing effective management strategies and providing appropriate support for HHT patients. Patients with pulmonary AVMs are at an increased risk of developing brain abscesses due to the direct connection between the pulmonary vasculature and the cerebral circulation. To mitigate this risk, the use of prophylactic antibiotics has been proposed as a preventive measure. This approach aims to reduce the risk of bacterial infections reaching the brain through the abnormal vascular connections. We will examine the evidence surrounding the use of prophylactic antibiotics in HHT patients with pulmonary AVMs and discuss the potential benefits and limitations of this preventive strategy. In this section, we will discuss the current and emerging imaging techniques for detecting and characterizing arteriovenous malformations, AVMs, in hereditary hemorrhagic telangiectasia, HHT. We will explore the advantages and limitations of techniques such as MRI, angiography, contrast-enhanced ultrasound, CEUS, and optical coherence tomography, OCT. Anemia is a common complication in patients with HHT and has been attributed to various factors, including iron deficiency. Chronic bleeding, particularly from frequent nosebleeds and gastrointestinal telangiectasias, can lead to iron loss and subsequent anemia. Understanding the role of iron deficiency in the pathogenesis of anemia in HHT is essential for implementing effective management strategies, such as iron supplementation and treating the underlying bleeding sources. We will examine the relationship between iron deficiency and anemia in HHT and discuss the implications for patient care. Sex hormones, such as estrogen and progesterone, have been implicated in the development and progression of telangiectasias in patients with HHT. The influence of sex hormones on vascular endothelial function and angiogenesis is complex and not yet fully understood. Hormonal changes during pregnancy and menopause can result in variations in the severity and frequency of HHT symptoms, particularly epistaxis. By exploring the effects of sex hormones on telangiectasia development and progression, we can gain valuable insights into potential hormonal interventions and management strategies for HHT patients. Understanding the long-term outcomes and survival rates of patients with HHT is essential for prognostication and tailoring management strategies. Several factors, including age, gender, disease severity, and the presence of specific complications, can influence the long-term prognosis of HHT. By evaluating large cohorts and long-term follow-up data, we can gain insights into disease progression, identify prognostic indicators, and refine management approaches. We will critically analyze the available evidence on long-term outcomes and survival rates in HHT and provide a comprehensive evaluation of the factors that impact prognosis. Hereditary hemorrhagic telangiectasia is a complex disorder with diverse clinical manifestations and genetic underpinnings. This video has unveiled the genetic mutations, abnormal angiogenesis, and management strategies, providing critical knowledge for accurate diagnosis and improved quality of life for HHT patients.